All right, everybody, thanks for being here. This is our regular Friday news conference with the Indiana University Health, the city of Bloomington, with the Monroe County as well also. So we are joined as always by Mayor John Hamilton of the city of Bloomington. Also on the call will be Monroe County Commissioners President Julie Thomas, IU Health South Central Region Central Region President Brian Shockney, Monroe County Health Department Administrator Penny Caudle, Monroe County Emergency Management Director Allison Moore, and IU's Assistant Vice President for Strategic Partnerships and the IUB COVID Response Unit Lead, Kirk White. We'll start off with opening comments from Mayor Hamilton.
Thanks so much, and welcome everyone on this October Friday. I will just briefly note again, this is a week, and we take each week at a time. Again, a week of good news locally. I know you'll hear details from Indiana University and from County Health about the testing numbers, and every week that those are improving is a very good week. We appreciate that. Of course, it is still a real danger in our community. We've had a death and continue to have to pay strong attention to this. But I just want to thank everyone for the great collaboration, both the parties that are all represented on this call, as well as the wider community. It is the actions, we said this for many, many, many weeks, it is the actions that we take that will determine the course of this disease and infection, and the actions that we've taken to date have been very important and effective so far in helping protect us against some of the risks. And I just want to thank everybody for that. We're not out of the woods. We won't be for quite some time. But I really want to note that positive story, positive news, and important reflection of what people have done. Really, frankly, the state numbers, and I'm not an expert in all this, but there are several indicators where the state is either flat or going the wrong direction on 7-day individual positivity, on hospitalizations, on positive cases, even deaths by day. So I do note, I really don't agree with the actions that are being taken at the state level. I think they're too soon and not consistent with the data indicators. But again, it is appropriate, and we appreciate that the state allows us locally to take decisions differently. And I really appreciate the staying the course collaboration that we're doing over the next few weeks, particularly kind of through Thanksgiving. I hope we can continue to focus on the data, focus on the positive movements, and make sure make sure that we do all that we can to avoid a backslide, including our mask order, including our tighter restrictions on gathering sizes of 15 for private gatherings in the city, 50 for the county outside the city for those private social gatherings, and then the continued 100 and 150 sizes for the indoor and outdoor gatherings, public gatherings, respectively, continuing the bars and restaurant restrictions. It's just been a really important collaboration. I want to thank everybody for doing that. I know you're going to hear, I expect today too, about the testing site collaboration, which is terrific as we work together on that next chapter of that, the flu shot efforts as well, and even Halloween as we're working together on that to have some consistent approaches based on CDC guidelines. So another week. I hesitate to call it a good week, but it's a week where we've seen at least holding steady and improvements, which is so important to continue to see. Thanks for everybody in doing that, and I'll be happy to take questions.
Okay, thank you, Mr. Mayor. Let's next go to Penny Caudle at the Monroe County Health Department.
Good afternoon. Thanks for having me again today. I will just start really with talking about the numbers just a little bit, not to get into the weeds, but the dashboard at the state continues to change, and they have added now the school map. I do think that there are still some kinks that they're trying to work out with that in terms of making sure that everything's in there appropriately. But that is another piece of information available to the communities, and we're happy to see that. Locally, as the mayor mentioned, our numbers do continue to improve daily, and our rates are reducing with our testing being stable. So we are still seeing lots of testing happening, and our daily positivity rate is coming down. So we do continue to monitor that. We're to look for special circumstances and areas where we may have maybe several people who are infected, and we're dealing with those as they come so that we don't have to deal with something more broad in terms of additional regulations and those kinds of things. I will say that we still see most of our transmission is among social groups, and it's people being lax, quite frankly, when they're in that comfort zone, right? That we feel comfortable with the people that we know, our families, for example, but yet they may be not immediate family, and so we're not really around them all the time. But when we are, then we think that it may not be the same risk as it would be otherwise, or just friends. It doesn't have to be family, just those friend groups as well. So when we talk about sort of those bubbles and those quarantines, or whatever you want to call them, we just need to remember that we need to be very careful, practice our distancing, mask wearing, and know that most people, maybe whether they're at work or other places, are around other individuals as well, and that most of us, if we're working, if we're doing other things, going out, that there may be some risks that we don't really recognize. So we just need to remain cautious and take those precautions that we need to take every day. The other thing that I want to talk about just a little bit is Halloween and holidays. I mentioned this earlier. The CDC has put out some good guidelines. We've reviewed those. And our recommendation from the public health standpoint is simply to follow those recommendations. I would say that Halloween especially is a time to be creative. People use their creativity to make costumes all the time. And so we just want to use our creativity in a way to make Halloween a little safer. And that will hold true for any holiday that you might be celebrating. So if you look at the CDC's website, you will find a list, and they have ranked them from lower risk activities to moderate to higher risk activities. So the traditional door-to-door, maybe I don't know who that person is, that type of trick-or-treating or traditional trunk or treat, those are higher risk activities, but you can make those a little safer. Can you do kind of participating in one-way trick-or-treating, setting the candy out, so it's kind of a grab and go, but you can still see those socially distanced trick-or-treaters walking down the street or coming through your driveway, but everybody's socially distanced, and we can do it in a much safer way. But there are still other ways that you can do it. You can have a scavenger hunt, whether it's just within your own yard or within your neighborhood. Maybe you want to have a socially distanced, physically distanced parade of costumes, those kinds of things. So I would encourage everybody to put on their thinking caps and their creativity caps and come up with some new and unique ways to have fun this Halloween and celebrate in a very safe manner. The other thing that I wanted to share today, and I think is very timely, today is National Disease Intervention Specialist Day, and we have 3 disease intervention specialists. We refer to them as DIS in our department, and we typically also house a state person, a state DIS, and they cover the state, but they kind of help us. We have a 12-county region. And these are really the ultimate contact tracers. And that's why I said this is very appropriate format to be able to give these individuals a shout out to all the DIS, but especially to Julie, Miranda, and Aaron, who are our local DIS. As I said, they are the ultimate. They are following up on sexually transmitted diseases every day and doing contact tracing, and actually the training that the CDC put together for contact tracers for COVID is based on contact tracing and training for our DIS. So they are extremely skilled and just want to give them a shout out today. The last thing that I will say is we have had a conflict. The Board of Health was scheduled to meet next Tuesday at 5:30, and we've, with all the Zoom meetings and new things, we've found a conflict. County Council is also meeting at that time, so we will be moving our Board of Health meeting to Thursday at 5:30. And that's all I have today. Thank you.
Okay, let's next go to Monroe County Commissioners President Julie Thomas.
Hello, good afternoon, everyone, and we're I'm grateful to everyone who's on this call and the way our communities bonded together and worked together to help fight COVID. It's been really impressive. Just a couple quick notes. The Washington Post actually did a study of Indiana households recently and noted that 112,000 of them were behind on their power bills. And that the total arrears were 4 times this same time period in 2019. So this is just a partial study, but it demonstrates the need to keep utilities going and to prevent disconnections during these hard times for so many families. So just a reminder to everyone that if you're falling behind in paying for your housing or your utilities, to please contact your township trustee. We've provided with the county council, we have provided township assistance funding to support these additional bills that we normally don't budget for and that the townships don't normally budget for. So please contact them for assistance. They have a lot of resources available in addition to this township assistance fund. Also a note, we continue to provide our CARES funding to local businesses and social service organizations, any business or organization in the county that needs assistance with COVID-related expenses that have not been covered by a loan or a grant, for example. And as of now, we have granted $128,199 to local businesses and social service organizations. We're really proud of that. And an additional $36,367 to local taxing units. The application is available on our county website, co.monroe.in.us, and the applications close November 30th. So please get those receipts together and fill out that application. Also, a quick reminder that voter registration closes on Monday, October 5th. I can't believe it's October already. And that in-person early voting begins on October 6th next week. So we are 7 months in. Everybody, I know it's hard to stay vigilant. This is not an acute crisis, but a chronic one. So please maintain your vigilance, please wear your masks, and do all the good things you're doing that are keeping Monroe County safe. You're doing it for your neighbors, you're doing it for your businesses in your community, not for yourself, but it's also a really good feeling. So please keep up that good work. Thanks, everyone. I'll take questions later.
Okay, next to Monroe County Emergency Management Director, Allison Moore.
Thank you, Chuck. I have a couple announcements today. We have added a blood drive for our evening time slots. So we have 2 October blood drives scheduled. The first is October 22nd, and it will be from the hours of 10 to 3. And the second is October 28th, and it will be from the hours of 2 to 7. I'll put both those dates and times in the chat. You can register for an appointment at redcross.org for those appointment times if you can and are willing to make that donation. And that information is also on our county website as well. I'd like to note that since COVID started, we started having these blood drives that the Board of Commissioners and Monroe County government started supporting. And we have collected 276 units of blood in our blood drives, which saves enough to save 828 lives. So between now and the end of 2020, our goal will be to try to save 1,000 lives with blood donations. And so if we can fill the evening time slots in October, then I will plan to make an announcement that we will add 2 for November and then again 2 for December. And if we can do that, then we should be able to potentially save 1,000 lives. So that will be our challenge, and I'll be coming back every month or every week to give a little update so we can see where we're at between now and December. And other than that, Chuck, that's all I have. Thank you so much.
Okay, we'll next go to Indiana University and Kirk White. Another good week for the numbers as they were reported.
Yes, it sure has been, Chuck. Thank you, and good afternoon. The Indiana University Bloomington mitigation testing trends and results are still down, and that's a good thing. As you mentioned, previous week we were at a 2.7% positive rate for mitigation testing. Those are the asymptomatic testers. That's down to 1.43% for this past week on the 7th-day moving average. And even the symptomatic testing has gone down significantly during that period as well, where the previous week it was at 28%, and then this past week down to just 20%. And remember, that's symptomatic, the folks who think they may be ill and are being referred for tests. Additionally, of course, I think people have seen the numbers perhaps, but in our Greek system, the numbers went from 3.1 down to 1.8%, and in our residence hall system from 2.2 down to 1.5. So it's been a good positive trend this past week, and as everyone's mentioned, it's only because of the great dedication that our community, the students, faculty, and staff are practicing, and we've got to keep this up. This is the way we're going to get this under control and to continue to have campus operations and continue our research and teaching missions. I can also, I'm very pleased to provide an update on the next major phase for us is to be able to even increase our mitigation testing. I think you might remember that we're doing about 10,000 of those tests a week. We want to be able to at least double that here yet this semester. So we're going to do that by having our own laboratory and processing operation that we've talked about before, and that should be up and running next month. And so those pieces are coming together. The plans are coming together. The parts are coming together so that we can repurpose one of those laboratories at the Bloomington campus to process at least double what we're doing now. It'll be less expensive for the university in the long run, and we'll have quicker results, so that we'll be able to cut the time from test to result in half probably, and that allows us then to get a hold of those who test positive in close contacts even faster, to do an even better job of getting folks quarantined or isolated and curb the spread. So that's a good report for how we're trending and how we hope to continue to do so next month. And again, I thank everybody for the good cooperative efforts.
Okay, let's next go to IU Health and Brian Shockney.
Good afternoon, everyone. While we have seen a fairly steady trend of COVID patients in our inpatient units across the system over the past 60 days, we want to keep that trend going forward. So let's not let us lure this into any kind of relaxation. We know the governor went to stage 5, but we also know that wearing masks and doing all the things that our elected officials are telling us to do and our public health are telling us to do are the key to this trend going down. And so we are doing a great job and we need to keep it up. And then the last thing, I just want to remind people to get your flu shot. We are doing several flu shot activities in the community. They're on the screen there. We are also providing over 2,000 flu shots to dedicated clinics in our community. And then our teams are also providing vaccines to local shelters to ensure our vulnerable populations are taken care of as well. So please ensure you receive your flu vaccine, whether that's through one of those times and places here on the screen or another way. This is a critical point and a critical step in making sure that you are healthy through this period of time, no matter whether we were in a COVID situation or not. It just makes it that much more important that we are. And that's the end of my statements, and I can take any questions. Thanks.
Okay, and we will be glad to take questions here in a moment. I want to go back to Mayor Hamilton for a moment. This is not necessarily COVID related, but certainly a tragic circumstance that also involved IU just a couple of days ago.
Well, thank you, Chuck. Yes, I know we focus here on COVID and what's going on in the community, but I do think it's appropriate to recognize and express condolences. There was an IU graduate student, 27-year-old Daniel Plabonik, who died very tragically in an automobile pedestrian accident right at the corner of campus, Indiana and 3rd on Tuesday morning. It was a running of a red light, it appears, in a tragic accident that took place. And we just, in this meeting, we talk so much about protecting each other and taking care of our community and doing so many good things, which we are. But I felt it was also appropriate for us to acknowledge Daniel and express condolences on behalf of the whole city, and I know the IU community as well, for his family and what they're going through. And I just wanted to add that, and then happy to turn it back to you, Chuck. Thank you.
Yeah. Thank you, Mr. Mayor. And Kirk, obviously a tragic circumstance. 27 years old. He was a PhD graduate student in brain sciences. And obviously our hearts go out to the family and everybody who knew him. Looking for questions here. I am not having any yet. Again, we have magically answered all of them, even with just our opening statements. But here we go. We've got our first question in. So this is from the B Square Beacon for Commissioner Julie Thomas. Related to the comments about township assistance, how much of the $100,000 grant that was made to the Township Association has been used so far? Do you foresee any need to make another appropriation to supplement that?
Thanks so much for the great question. We don't get reports every week, but our last report indicated that about $12,000–13,000 had been distributed in the community, and that was in 2 townships, although the money is available in every single township. But we assume that that number is going to increase. So we're still under the $100,000 appropriation cap, but we are ready. If more money is needed toward the end of the year, whatever is needed, we are ready to move forward and get some more money appropriated, thanks to the great work of the Board of Commissioners and the especially Monroe County Council. We're ready to act if we need to. Thanks.
Question from Emily Ernsberger from the HT, and I guess this would be best directed towards Mayor Hamilton, asking when we will receive CBU test results.
Thank you. This is it's really fascinating. I actually spent some time yesterday with the CBU. As folks know, they are now doing multi site testing, 8 or 10 sites around the community, several times a week, to look for the virus in wastewater. And the bad news is that this is really an experimental scientific process that's under quite rigorous oversight and scientific evaluation of how effective this is. So while we have results, and we will be sharing them and have been sharing them with health department and folks to try to see what we can see from this. The scientists in charge of this say we really don't want to release these publicly until we have the full test done, which will be about 4 to 6 weeks from now, and they can do a complete kind of review of what we learned, what we knew, where we see spikes and such. And it is a little frustrating for me that is not publicly available yet by the experimenters, the scientists who are doing this. But we should be able to see that final report in about 4 weeks, I gather, something like that. I will share, and one of the reasons we wanted to do this testing is we are using it and sharing it with our colleagues who are doing the assessments to try to see if there are any outliers or indicators that suggest something different from what we know. And the basic story from the CBU testing has been to confirm what we've seen in the IU testing in particular, where we've seen hotspots, those have shown up in this testing. For example, the Greek system or things like that have shown up in the wastewater testing. But again, the scientist part of it are saying we just don't know enough for sure about how accurate this is. I will say it also can be done, and we've been working with folks to say maybe you can move your testing site if we see a possible rise here or there, that we could zero in on it. I think the last thing I'll say about it is it's going to be really interesting and important that for those who research what has happened, why have certain universities and certain communities done well or done poorly, this will be another really important data point to look at, because there are indications from the science that the virus can show up a little bit earlier in the wastewater than in symptomatic testing. And so that's, anyways, it's going to be really important data to understand what happened. It is used now to calibrate, but I'm told by the science folks that until the data has all been reviewed, assessed in some different locations as well, they'll release it publicly in 4 to 6 weeks, I think. So, thanks.
Okay. Awaiting some more questions here. Kirk, I want to turn back to you, and you may have mentioned this, and I apologize if you did and I didn't catch it, but Brian was referring to getting flu shots. We are requiring flu shots for faculty, staff, and students on campus starting, I have to get it before December 1st. Can you elaborate on what that will look like and how we'll help that along?
Absolutely. We've not rolled out the full plan yet because we really wanted to make sure that we had enough supplies for us to roll ahead. And so we've been working with the normal pharmaceutical companies that we purchased the vaccines from, as well as working with the state. And we think we're just about to the point to have enough supply that we can put a timeline in place and open up the clinics on the campus, which, by the way, will be separate than the ones that we're using for mitigation testing, so that people can then pick the dates and times that they want to come to the clinic. We didn't want to be in a spot where we announce dates and times and then we have to cut them off when we ran out of supply. So we hope to get that published here within the next week or so, week or two at the latest, so that we can get this going. Yes, all students, faculty, and staff will be required to get a flu shot. We'll provide it. If you want to use your own private provider at your personal physician or at one of the many private sector locations in the community, or through IU Health, or the other hospital and healthcare facilities, they're more than happy to do that. Of course, the drugstores, urgent care facilities, Kroger's, for example, CVS, and others you're more than welcome to do that as well. But just grab a hold of the documentation that they give you. You'll have a chance to list that with the form that you'll fill out saying that you did get your vaccine for IU students, faculty, and staff, with the online form that we'll have up and running.
Okay, thanks, Kirk. And I'm going to vamp with my own question for one more, at least, while I wait if anybody else has any other questions. But Brian, one of the reasons that IU has emphasized the flu shot in particular is because of, a few reasons, but among them is the stress it could put on the healthcare system if a lot of people get the flu and we have a bad flu season, but also it emulates COVID in some ways, and you can get COVID and that at the same time. Can you elaborate on that?
Yeah, that is true. Everything that you said. We've had years in the past where we have been at capacity with our beds, even over capacity, just from the regular flu. And so we are still learning about COVID. We're still learning about the flu and how that interacts with COVID. You're right, symptoms are very similar. So we're going to have to treat those very similar in their initial stages until we can get the testing for either the flu and the COVID to determine which which it is. Either way, it's contagious, and we have to isolate. And so it goes back to our best practices. Wear your mask. Just constantly wear your mask, wash your hands, do all the things that you need to do. Physically distance. We're coming up on the holidays, and we just want to be sure that we're being very careful, that we're not exacerbating the normal flu, as well as the spread of COVID through our communities. So yeah, it's a concern. We really have a high concern. That's why this is the first time you're going to see this many flu shots, and IU Health has ordered tens of thousands of additional flu shot vaccines, and we're going out and about, and we'll put a needle in anybody's arm who wants one. So no questions asked. We'll just make sure we get you vaccinated for the flu.
Chuck, I might just add a little more to that, and Brian can chime in here. We at the campus direct symptomatic testing through our partnership with IU Health. And it's my understanding that IU Health, when you get tested for COVID, starting now, maybe later, eventually, they'll be testing for flu at the same time. So if you get a negative test for COVID, they're also testing for flu. And so you may have influenza and not COVID. And that way you'll know the difference, or vice versa. Because we've started discussing how best to counsel our students, faculty, and staff about, well, do you have a cold? Do you have the flu? Or do you have COVID? Because we know this will just add to the stress level of people not being sure what they have. If they test negative for COVID, they think, well, maybe I still have it, but they really have the flu. So we're working on our messaging when we, through our partnership with IU Health, when you get a positive COVID test, the IU Health folks counsel you on what you need to do. We're adding some of that guidance about the flu and about standard head cold as well.
Emily Ernsberger, following up on flu shots, she says she may have missed this when you said it the first time. How much, Brian, are the flu shots that you're offering? And for Penny, can people come to the health department for flu shots this year as well?
So if people have health insurance, we will have them fill out a form if they would, if they want to, and we will bill their health insurance. There will not be a charge for them to get that flu shot. However, we are giving the flu shot for free. If people do not have means, we're giving them the flu shot, and we're billing insurance if they have it. That's it. It's about getting the flu shot. It's not about the charge and the cost. So, this is just like any other pandemic. The flu can just add to it. So, yeah. So we will not be charging cash for people to get their flu shot or anything like that. If you have insurance, we will have you give us some short information, and we'll bill that insurance. But it's not a requirement. Don't let that be a barrier to you getting a flu shot.
And Emily, in terms of coming to the health department, if you recall, many times I would talk about the partnership that we have with IU Health for public health nursing and the Monroe County Public Health Clinic, which is on Miller Drive. So people can certainly go to Miller Drive and get those flu shots. The public health nurses are scheduling, as they do every year, school clinics, and we are working on plans to get other clinics set up as we are able. So you can't come to downtown, you can't come to Showers or 7th Street. You won't get a flu shot there, but the Miller Drive Clinic, and I would encourage people to check out the hospital's website for information about that.
Yeah, and I think Penny makes a good point. We are going into the Monroe County schools as well as the Richmond Bean Blossom schools and giving vaccinations. And then we have several business partners through our occupational health, and we are going into all of those businesses and vaccinating their team members as well.
Question from Dave Askins at the B Square Beacon for Commissioner Thomas, maybe Mayor Hamilton, about the CARES Act funding that the county is administering. Does the city of Bloomington have the ability to get reimbursement through that program, or does the city have its own separate avenue for reimbursement?
Yeah, the CARES funding was divided up, and so the city of Bloomington and Ellettsville and even Steinsville received a share of funding. It was based on population. Monroe County has a set of funds, and we've elected to utilize those funds for a number of things. Of course, we've had a lot of expenses with laptops and people working from home and Zoom licenses, and you can imagine the cleaning supply list is very long. So we've had a lot of items have already gone in, and we've already received reimbursement from the state. And we continue to put those items in, and also FEMA funding. We're using FEMA funding as well. And big thanks to our staff and auditor's office and Allison Moore for helping out with coordinating all of this. But we've elected to utilize some of our CARES funding to provide direct aid to keep our county businesses and social service organizations afloat. It's certainly not something we had to do, but it's certainly something we felt like we really wanted to do to try to make sure that our economy is vital when we emerge from this pandemic.
Yeah, I agree with all that. And I think it's a terrific collaboration, as often happens, where the county, for example, is also stepping up, as Commissioner Thomas often mentions, through the townships to help support eviction relief and protection as they do so well, and supporting that effort countywide for everybody in the county on eviction relief or problems with paying bills. The city does have separate CARES funding. We're using it in lots of different ways, as the commissioner mentioned, as well as support for services that we're reaching out to the homeless population and other populations in need. And as it's probably worth mentioning too, the food and beverage revenue, we've now gone up to about, I think, 1.8 million, give or take, of food and beverage dollars that have been lent out, primarily some grants, but also loans to many establishments to help them get through this. And I think it's been a really good collaboration. And I'll just really briefly also just say, in the vein of was it Sherlock Holmes, the dog that didn't bark, the story that you have to pay attention to what you didn't hear, what didn't happen. The fact that this community, which faces in many ways really extraordinary challenges with 35,000 students coming back from all around the country and the kind of living situations that we have here, the fact that this collaboration over these last 6 months to focus on the data and taking the steps that we have taken together, the fact that this very large university and that this city continue to be able to operate with the classes as they've been doing, with the bars and restaurants opening responsibly as they have, with the school system operating. The dog that didn't bark is the resurgence that hasn't happened. And as we hear today, of course, we're not out of the woods, and the flu season comes back, and we've seen circumstances where that may not happen. But I do hope that the fact that we have together, in many ways more aggressively than the state have together taken these steps. I think it's really important to note that absence, I guess, in a circumstance that could have been very different, and still could be. We are not in any way out of the woods, but I just wanted to note that. And thanks for everybody's collaboration on that.
Well, thank you very much, Mayor Hamilton. I am seeing no other questions, and I'll give it just a moment here before we sign out. But a reminder that, again, we will be back again next Friday at the same time, 1:15, and I'm going to go ahead and wrap it up just a couple of minutes early. Thank you, everybody, for being here, and thank you for your questions from the media, and we will see you next week.
Thanks, Chuck. Be well. Have a good week.
Thanks.